Hey everyone, welcome back to all my listeners. This is episode 6 in season 18. Today is Wednesday, July 8th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, well, welcome back to another episode. I hope everybody is well rested from the long weekend, the 4th of July holiday. I know here in Chicagoland, it was pretty much a washout right up until about 7 or 8 p.m. that evening. So throughout the region, people were canceling the festivities left, right, and center because we really did have a lot of rainfall. Ironically, on Friday and Saturday combined, just around 3+ inches of rainfall. So I know festivities in my area only alerted us all that things would be on. But many people just didn't turn out because it was just soggy and mosquito filled. But anyway, for our 250th birthday in the US, I know places like New York, DC, Philly had great fireworks, great shows that were put out. Lots of drones were involved. There was just so much good stuff to see. So I got to catch some of the highlights on TV and Instagram, etc. All of those great places that I can catch up on stuff. Also, World Cup soccer has been a big hit. A lot of upsets, a lot of people's betting has been going sideways because a lot of those underdogs came through and won. And of course, some of the tried and true favorites suddenly lost over the past couple of days. So I know we're in for another couple of big weeks still left in World Cup. So I hope everybody is tuning in or heading out to your local bars to make sure that one of the TVs at the very least is pointing to a World Cup soccer match. So anyways, you guys, that is it for the second week of July. It's just hot and sizzly, lots of rain here and there. And things are looking much greener on this side of the nation versus last year, where we were in a complete drought and things were just brown and sandy, very dusty. We had a lot of stray wildfires that happened last year, but so far we are looking nice and green. So hopefully we aren't affected by those sporadic wildfires that we normally have every couple of years or so. So anyways, you guys, let's go ahead and get into today's episode. You know, it's the second Wednesday of the month, and I normally feature my OIG Work Plan updates during that second week. And here we are, second week of July. So I'll be talking about my OIG Work Plan updates for the month of June 2026. And in my trusty tip, I wanted to quickly discuss some current SMRC audits for wound debridement services. Yeah, that's a mouthful, but I'll unpack it when I get to that segment. And of course, I'll go ahead and close out and round out today's episode with a remarkable quote by Tony Robbins. All right, you guys, let's get into it. So in today's Newsworthy, the month of June's OIG Work Plan updates. There are a total of 12 updates that were made to the OIG Work Plan for the month of June 2026. Now, the OIG is trying new things out for the first time. I know I've been talking about these OIG Work Plan updates for years, and they are switching things up, and that's great because change is always welcome. So this month, there are a total of 5 projects as well as 7 series projects. So I will unpack all of them for that total of 12 updates for the month of June 2026. Now, the first OIG Work Plan update for the month of June 2026 is titled Trends and Vulnerabilities in Genetic Tests Covered under Medicare Part B. Now, this report is expected from the Office of Evaluation and Inspections. Medicare Part B spending on genetic tests has been climbing steadily, with 2024 expenditures topping $3.6 billion, a $500 million increase over the previous year. Genetic tests can harness the power of technological advancements to provide Medicare enrollees and their providers with valuable insight into disease risk, prevention, diagnosis, and treatment. However, the rapid emergence of new tests and the higher average per test payment amount can also make genetic tests vulnerable to fraud, waste, and abuse. Prior OIG work and its law enforcement partners have identified genetic testing fraud schemes involving deceptive telemarketing campaigns and kickbacks. This study will examine avenues for strengthening oversight of genetic tests covered under Medicare Part B, including identifying tests that may be vulnerable to fraud, waste, and abuse, assessing trends among laboratory test providers, and examining whether geographic variations exist, particularly between jurisdictions that do and do not participate in the Molecular Diagnostic Services Program. Now, there is no timeline indication for the final report expectation. Moving on, the second OIG Work Plan update made for the month of June 2026 is titled Focused Review of State Child Care and Development Fund Program Integrity Efforts. Now, this report is expected from the Office of Evaluation and Inspections. The Child Care and Development Fund, or the CCDF, is a block grant that subsidizes childcare for low-income working families. The program is administered by states, which are required to develop internal controls to address CCDF program integrity. This evaluation will assess the extent to which all states conducted specific program integrity activities and the outcome of states' efforts. The OIG will review states' activities to assess provider records of childcare enrollment, attendance, and billing. The OIG will also identify efficient and effective program integrity activities states conducted and challenges those states experienced when conducting the selected activities. Again, there is no timeline indication for the final report expectation. Moving on. The third OIG Work Plan update made for the month of June 2026 is titled Data Brief Snapshot of Alaska Area Indian Health Service Sanitation Facilities Construction Projects Funded under the Infrastructure Investment and Jobs Act. Now, this report will be expected from the Office of Audit Services. Under the Infrastructure Investment and Jobs Act, or the IIJA, Congress allocated a total of $3.5 billion over 5 years to the Indian Health Service Sanitation Facilities Construction, or FFC, program to provide American Indian and Alaska Native peoples with essential water supply, sewage disposal, and solid waste disposal facilities. The OIG will review data for IIJA-funded FSC projects in Alaska from October 2021 through April 2026 to, number one, summarize Alaska area's IIJA funding allocations and disbursements made, and number two, highlight any challenges that Alaska area has faced in administering FSC program projects and actions it has taken to address those challenges. Again, there is no timeline indication for the final report expectation. Moving on, the fourth OIG Work Plan update made for the month of June 2026 is titled Medicare Payments to Providers for Selected Expanded Laboratory Panels. Now, this report is expected from the Office of Audit Services. Expanded laboratory panels are tests that can detect 6 or more pathogens. They result in higher Medicare payments to providers. Those are hospitals, laboratories, and physicians. Then targeted laboratory panels, which are tests that can detect up to 5 pathogens. There are concerns that providers have been administering expanded laboratory panels when targeted laboratory panels would be sufficient, resulting in significantly higher Medicare payments to those providers. Medicare payments are not allowed for items or services that, quote, are not reasonable and necessary for the diagnosis or treatment of illness or injury or to improve the functioning of a malformed body member, end quote. And this is pursuant to the Social Security Act, Section 1862A, 1A. In addition, some Medicare administrative contractors, the MACs, have implemented local coverage determinations that include requirements providers must meet to receive Medicare reimbursement for expanded laboratory panels. The OIG objective is to determine whether Medicare paid providers for selected expanded laboratory panels in accordance with Medicare requirements, including MAC requirements. Again, there is no timeline indication for the final report expectation. Moving on, the fifth OIG Work Plan update made for the month of June 2026 is titled Medicare Payments to Suppliers for Therapeutic Shoes for Enrollees with Diabetes. Now, this report is expected from the Office of Audit Services. Medicare covers extra depth or custom molded shoes with inserts for an enrollee with diabetes under the medical and other health services benefit, provided that certain factors are met. like the physician who is managing the enrollee's diabetic conditions documents the qualifying foot condition and certifies that the enrollee needs such shoes under a comprehensive plan of care related to the enrollee's diabetic condition. And this is pursuant to the Social Security Act, Section 1861 S12. For calendar years 2024 and 2025, Medicare paid more than $143 million for therapeutic shoes and inserts. For both years, CMS's Comprehensive Error Rate Testing, or CERT program, reported high improper payment rates for therapeutic shoes and inserts due to insufficient documentation. Upon request, suppliers must provide documentation that justifies Medicare payments for therapeutic shoes and inserts. The OIG will determine whether Medicare paid suppliers for therapeutic shoes and inserts in accordance with Medicare requirements and guidance. Again, there is no timeline indication for the final report expectation. Moving on, we're going to head into the series section of this month's OIG Work Plan updates. So the sixth is for a series, duplicate Medicaid fee-for-service and Veterans Health Administration payments. Now, this report is expected from the Office of Audit Services. Subject to a few exceptions, Medicaid is the payer of last resort, meaning that Medicaid will pay for a service only if there are no sources of payment available. Federal law requires that if a Medicaid enrollee has any other source of coverage of funding for a service, for example, a third-party liability, that source must pay before Medicaid pays. Under the Veterans Community Care Program, the Department of Veterans Affairs, the VA, enters into arrangements with non-VA providers to furnish hospital care and medical services to eligible veterans. When the VA authorizes community care services for a veteran who is eligible for both VA and Medicaid benefits, VA is solely responsible for paying for those medical services. Duplicative claims may be improperly paid by both Medicaid and VA if claims for services are billed to both programs. OIG will conduct a series of audits to identify duplicate Medicaid fee-for-service and VA payments across various states. Specifically, Phase 1 will include audits of states with a large population of veterans receiving community care services. And in Phase 2, the OIG will perform an audit across all states to calculate a nationwide error rate for duplicate VA and Medicaid fee-for-service payments. Now, today, there is one active project in this series. The series completion is expected in fiscal year 2028. Moving on, the next series, number 7, in the OIG Work Plan updates made for the month of June 2026. Series, National Institutes of Health Grant Recipients Compliance with Federal Cost Requirements. Now, this report is expected from the Office of Audit Services. The National Institutes of Health, the NIH, funds research activities intended to advance understanding of human diseases and related health conditions. The research project, or R01, is NIH's most commonly used grant program for independent research projects. In fiscal year 2025, overall funding for R01 equivalent grants, which include R01 grants, reached $20.84 billion, representing a 4.1% increase over the prior year. Because these awards represent a significant federal investment in research conducted across a wide range of recipients, ongoing auditing is essential to ensure that funds are used in accordance with federal and award requirements. Using a risk-based approach, OIG will conduct a series of audits of selected recipients to determine whether they used NIH funding in accordance with the terms and conditions of the grants and applicable federal requirements. Today, there is one active project in this series. The series completion is expected in fiscal year 2028. Moving on. The next item in the series for June 2026 OIG Work Plan updates. Number 8, series, Nationwide Analysis of States' Single Audit Findings for the Child Care and Development Fund and Medicaid programs. Now, this report is expected from the Office of Audit Services. The Single Audit Act requires states and other entities to undergo an assessment, known as a single audit, to determine the entity's financial integrity and compliance with federal requirements. The Administration for Children and Families, or ACF, and CMS use these audits to oversee the Child Care and Development Fund, or the CCDF, block grant, and Medicaid. The OIG will determine, number one, the timeliness of states' fiscal year 2023 through 2025 single audit report submissions. They will also determine the types, number two, the types of single audit findings and the commonalities among these findings for the CCDF and Medicaid programs. And finally, number three, they will also determine the actions ACF and CMS have taken during the audit resolution process to ensure that states address recommendations to meet CCDF and Medicaid program requirements. Now, there are two active projects in this series. The titles of both are Nationwide Analysis of States' Single Audit Findings for the Child Care and Development Fund. And finally, the second one is called Nationwide Analysis of States' Single Audit Findings for the Medicaid program. Now, this series completion is expected in fiscal year 2028. Moving on, the ninth item in our series, the ninth item for the OIG Work Plan update for the month of June 2026. Number 9, series, Audits of Medicaid Non-Emergency Medical Transportation Services. Now, this report is expected from the Office of Audit Services. Federal regulations require states to ensure that Medicaid enrollees have necessary transportation to and from healthcare providers. To meet this requirement, states cover the cost of transportation and related travel expenses. For example, non-emergency medical transportation, or NEMT, determined by the state Medicaid agency to be necessary to secure medical examinations and treatment for enrollees. Each state may have different Medicaid coverage criteria, reimbursement methods, rules governing covered services, and enrollee eligibility for services. Generally, prior authorization for NEMT services must be supported by a medical practitioner's order, and NEMT providers must be lawfully authorized to provide transportation services and must maintain records supporting services provided. OIG will determine whether the selected states complied with Medicaid payment requirements for NEMT services. Today, there is one active project in this series. The series completion is expected in fiscal year 2028. Moving on, the 10th item in the OIG Work Plan update made for the month of June 2026 is another series item. Number 10, series, Audits of Medicaid Home and Community-Based Services Eligibility. Now, this report is expected from the Office of Audit Services. Home and community-based services, or HCBS, include services such as personal care at home, adult daycare, and rehabilitative care. Those services that allow enrollees who are elderly or those who have disabilities to receive long-term care services in their own homes or communities rather than in a nursing home, hospital, or other institutional setting. It's crucial to ensure that Medicaid enrollees receive the HCBS they need and that managed care plans deliver value for the taxpayer dollars they receive. Nationally, Medicaid HCBS expenditures totaled $129.4 billion in 2022, with HCBS services delivered through a managed care model totaling $49.1 billion. Now in 2023, those amounts increased, with national Medicaid HCBS expenditures increasing to $145.9 billion and HCBS services delivered through managed care totaling $54.3 billion. The OIG plans to conduct one or more audits of states examining HCBS expenditures. OIG will determine whether the state agency made Medicaid managed care HCBS payments for eligible enrollees in compliance with federal and state requirements. Today, there is one active project in this series. Project titles will remain unpublished until projects are complete and reports are posted. The series completion is expected in fiscal year 2028. Moving on, the 11th item in the OIG Work Plan update made for the month of June 2026 is another series. Number 11, series, Rebates for Physician-Administered and Pharmacy Drug Claims. Now, this report is expected from the Office of Audit Services. States are generally required to collect rebates on physician-administered and pharmacy drugs in order to receive federal matching funds for those drugs. Previous OIG work identified significant concerns with states' efforts in obtaining rebates for physician-administered drug claims. The OIG will follow up with select states to determine whether states have implemented controls to ensure ongoing compliance with federal Medicaid drug rebate requirements. Now, there are 6 active projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. All reports are expected to be finalized, and series completion is expected in fiscal year 2028. Now, the 12th and final OIG Work Plan update made for the month of June 2026 is yet another series. Number 12, series. Medicaid Managed Care Early and Periodic Screening, Diagnostic and Treatment Behavioral Health Services. Now, this report is expected from the Office of Audit Services. Mental health in childhood includes reaching developmental and emotional milestones and learning healthy social skills and coping skills for when problems arise. Medicaid's mandatory early and periodic screening, diagnostic and treatment benefit, or the EPSDT benefit, requires that children under the age of 21 who are enrolled in Medicaid receive all medically necessary services, including behavioral health services, which include services for mental and substance use disorders. Many states include coverage of behavioral health services for children and youth in their Medicaid state plans and through various Medicaid managed care waivers. OIG will determine the extent to which children enrolled in Medicaid received EPSDT medical screenings and, if diagnosed with a behavioral health condition, whether behavioral health treatment services were provided. OIG will also review whether states and managed care organizations met federal and state requirements for providing EPSDT behavioral health services. Now, there are 3 active projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. All reports are expected to be finalized, and series completion is expected in fiscal year 2028. And now it's time for my best practice tips in Trusty Tip. With all the buzz that's been going around in wound care, I wanted to highlight another type of audit that is hot and heavy right now. It is the SMRC audit, the SMRC audit. Now, I know I've discussed the SMRC on the podcast in years past, but it's time for me to go back to it and highlight their important work once again. Now, the SMRC audit is titled 01-165 Wound Debridement Select Coding Notification of Medical Review. Now, this is coming from Noridian Healthcare Solutions, LLC. They're just known as Noridian, and they are the supplemental medical review contractor, the SMRC, the SMRC, for the CMS. So it is Noridian that is in charge of these SMRC audits. Now, they are conducting post-payment reviews of claims for Medicare Part B for wound care debridement services billed on dates of service specifically from January 1st, 2024 through December 31st, 2025. So that's 1 full year. That is the scope of the audit. Now, this notification includes the reasons for the review, documentation that will be requested in the additional documentation request letter, the ADR letter. I've also talked about that over the years, as well as resources that providers or suppliers may wish to consult with when they're submitting claims. So they do their very best to help providers and suppliers with many resources that are provided in the letters as well. So they want to help the providers and suppliers successfully go through the SMRC audit. Now, let's touch on the background here that Noridian has posted regarding this SMRC letter. Background: debridement. Debridement is the process of removing unhealthy or foreign tissue from a wound to reduce infection, clean the area, and promote healing. Debridement continues until healthy tissue is exposed and can be performed using methods such as cutting, scraping, scrubbing, or irrigation. Wound debridement services are coded based on the depth of tissue removed, and surface area of the wound. I love auditing for these types of services. I love helping coding professionals code these types of services as well. Now, the surgical debridement current procedural terminology, or CPT codes, include CPT code 11042 through CPT code 11047. Now, these codes report on the depth of the tissue that is removed, as well as the total surface area of the wound or the wounds. Now, this code series is used for surgical debridement involving deeper tissue levels when no direct primary closure, such as grafting, is anticipated. Proper coding for surgical debridement requires documentation of both the post-debridement wound measurement and the tissue depth removed, which may range from subcutaneous tissue all the way down to the bone. Now, wound care CPT codes are 97597 through 97598. These codes apply to active wound care to the epidermis and dermis. So those are those upper layers of our skin. Now, active wound care management refers to procedures performed to remove devitalized and or necrotic tissue to promote healing and may require multiple sessions. The CPT code 97597 involves debridement of open wound or wounds and includes a topical application or applications, wound assessment, use of a whirlpool when performed, and instructions for the ongoing care of a wound. And the add-on code, CPT code 97598, is reported for each additional 20 square centimeter. Methods include high-pressure water jet and sharp selective debridement techniques using scissors, scalpels, and or forceps. Now, according to CPT guidelines, CPT code 97597 and 97598 must not be reported in conjunction with our CPT codes in that range, 11042 through 11047, for the same wound on the same date of service. Now, in June of 2024, Noridian, the SMRC, completed their research and data analysis on wound care services furnished for beneficiaries during a home health episode of care by either a Part B clinician or a home health provider. Now, the SMRC identified a potential area of vulnerability when surgical wound debridement codes were billed to Medicare Part B for the same beneficiary on the same date of service as other wound care services. Now, the reason for the SMRC's review, the letter outlines this very clearly. The SMRC is tasked to perform data analysis and conduct medical record reviews on claims billed with Part B services. Surgical debridement CPT codes 11042 through 11047, as well as wound care CPT codes 97597 through 97598, billed with date of service in that scope, right? January 1st, 2024 through December 31st, 2025. So the SMRC will conduct coding reviews in accordance with applicable waivers, flexibilities, statutory, regulatory, and sub-regulatory guidance. Now, the SMRC also provides a great sample, a claim sample detail that all of you should be reviewing on the Noridian or SMRC webpage. And they go over the CPT codes as well as the definition of those CPT codes, which you know, over the years, I love to provide the audience with a definition of what those particular CPT codes actually mean. So CPT code 11042 is defined as debridement subcutaneous tissue includes the epidermis and dermis if performed the first 20 square centimeters or less. Then for our CPT code 11043, that's for debridement. That is for the muscle and or fascia. Again, so we're going deeper and deeper, right? So from the sub-Q tissue in CPT code 11042, we're going down a little bit deeper into the muscle or the fascia for our CPT code 11043, right? And they also talk about the measurements there as well. It's the first 20 square centimeters or less. Moving on to that CPT code 11044, that's the debridement all the way down to the bone, right? So that will include the epidermis, the dermis, the subcutaneous tissue, the muscle and or the fascia if performed, right? So all of those layers are cut through first all the way down to the bone. And again, that's also for the first 20 square centimeters or less. And then there is CPT code 11045. That is for our debridement subcutaneous tissue. That is for each additional 20 square centimeters. So again, it's starting up from the subcutaneous, and that's for each additional square centimeter measurement. All right. And then for our CPT codes 11045, 11046, and 11047, those are all for the each additional 20 square centimeters for the subcutaneous muscle and or fascia and then bone, respectively. Then let's quickly move on to the CPT codes 97597. That is also for our debridement or high pressure water jet with or without suction, sharp selective debridement with scissors, scalpel, and forceps, open wound for the fibrin, the devitalized epidermis and or the dermis, the exudate, the debris, the biofilm, including topical applications, as well as wound assessment, use of a whirlpool when performed, and instructions for ongoing care per session, total wounds, surface area, first 20 square centimeters or less. So there's a lot of documentation that has to be recorded subject to this definition of our CPT code 97597 for wound care. And then let's finally go over the last CPT code involved here, and that's 97598. And that is also for debridement. For example, high pressure water jet with or without suction, sharp selective debridement with scissors, scalpel, and forceps, open wound, for example, fibrin, devitalized epidermis and or dermis, exudate, debris, biofilm, including topical applications, wound assessment, use of a whirlpool when performed, and instructions for ongoing care per session, total wounds, surface area. And this is for each additional 20 square centimeters or part thereof, right? So that has to be done in addition to the primary CPT code, which was the one we just talked about, that CPT code 97597. That is the primary code. And then that add-on code has to be the 97598. So we have to have somebody who understands all of the coding requirements that are at play here. All right, then we go over documentation requirements, all of the documentation that has to follow all of these coding definitions. So here's a list of specific documentation requirements that the SMRC, that Noridian, is outlining that providers and suppliers should be aware of. So these need to be included in each ADR to obtain the necessary documentation to perform the review. Now, providers and suppliers are requested to submit each of the documentation requirements outlined, if and as applicable to the claim on review. So they highlight the operative note or procedure report for the date of service under review to include the following: tissue removal, which means the skin, full or partial thickness, subcutaneous tissue, muscle, and or bone. So that tissue removal must be documented. They also have to talk about the level of debridement in square centimeters, right? I talked about the subcutaneous down to the muscle or fascia all the way down to the bones. We have to talk about the layers of debridement that are being performed and then documented. You also have to talk about the method you're using to debride, right? In those definitions, I gave you various words like hydrostatic, sharp, abrasion, right? What are they using? What method are they using to debride that wound? And then our documentation also has to include the measurement of wound surface area after debridement. So documentation to support the codes and modifiers being billed, we have to have that as well. Our providers and or suppliers are encouraged to review the documentation prior to their submission to ensure that signature information is available. Please include a signature log or signature attestation for any missing or illegible signatures within the medical record. So that's always an easy one when you're working with VCMS, is you can always provide them, send them in with a signature log as a signature attestation for anything that is chicken scratchy, right, in today's terms, if you're not using the EMR. Now, if an electronic health record is utilized, include your facility's process of how the electronic signature is created. Include an example of how the electronic signature displays once signed by the physician. It's always helpful. They want to work with you side by side to make sure they're understanding how your EMR is actually working, how it's capturing the signatures, as well as those credentials of the providers and their date stamp as well. Now, they also go on to talk about the Advanced Beneficiary Notice of Non-Coverage, the ABN, the Notice of Medicare Non-Coverage. That has to be included in the ADR submission as well. Medical record documentation to support the national and local requirements, right? If there's an NCD, that's at play. If there is an LCD in your specific region for your MAC. Now, any other supporting and or pertinent documentation you must include. And then finally, the SMRC ends with, if the medical record documentation is submitted via ESMD, the beneficiary identification number, the date of service, and the provider of service should be clearly identified on each page of the submitted documentation. And finally, I focus on this season's Spark. So in this week's Spark is from Tony Robbins. By changing nothing, nothing changes. I love this quote on change. You've got to have a shift in mindset this month. I truly believe that. Change can also be filled with a sense of wonder and excitement. We've got to get out of the comfortable way of living and change. These days in the month of July are all about getting uncomfortable, right? Change is often thought of with negativity, steeped with our fear and anxiety that we place upon change. So I encourage a complete shift in mindset this entire month. Stay open to change, stay curious, and see what change can bring to you. I'm happy Tony Robbins' spark burns brightly and can still inspire so very many. All right, you guys, that wraps up today's episode. I hope you got a lot out of today's OIG Work Plan updates. There are so many that I'm looking forward to in the next few years when they finalize their series as well as individual reports and they come out with their findings. I always look forward to reading the full reports. And of course, stay tuned for those SMRC letters if you happen to be a wound care provider. They are circulating around the country currently, so make sure you understand what types of documentation you need to maintain and retain in your records, especially if you are in this wound care space. It's just a matter of time when you will receive some sort of a post-payment audit or a SMRC review letter. Things like that are going to be flying out the door here within 2026 and 2027. Wound care is really, really a hot ticket item, and we really have to be vigilant on correct coding and compliant documentation as well. So anyways, you guys, I hope you have a lot of exciting things going on in the next weeks ahead. I know we just had a big holiday, but hopefully you also have a holiday scheduled, an airplane ticket that's been booked, hotel stays have been purchased. Hopefully you guys have a lot of fun things in the horizon for you. I know I do. So anyways, you guys, thank you so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.